Hi, I'm Lieutenant Tommy Banneker, and welcome to What's on the Truck Tuesday. Today we're going to be talking about our video laryngoscope. This is a device used to intubate a patient when we need to perform advanced airway procedures and to treat our patient appropriately. As you can see, we have a couple pieces of equipment here. One is our video laryngoscope with our camera. It allows us to visualize the actual airway. Our laryngoscope blade, and our ET tube that's used to actually enter the trachea. We have our BVM. This provides ventilation for the patient at any rate that we decide, and it provides 100% oxygen using our oxygen tank here. So prior to intubating our patient with our air track camera, we're going to provide ventilations to our patient to make sure they have enough oxygen prior to the intubation attempt. So this is our air track camera. It allows us to visualize the vocal cords when we enter the patient's mouth. The vocal cords are the landmark that we use to know that we're entering the endotracheal tube into the trachea and not into the esophagus. A couple patients that we might feel the need to use this on is somebody with airway burns, someone that has just been involved in a drowning, any cardiac arrest patients, or someone with severe respiratory distress. So when performing the intubation attempt, the blade enters the patient's mouth, glides on the tongue, and allows us to visualize the vocal cords. Once we visualize the vocal cords, the ET tube is placed inside the actual trachea, and then we confirm it using multiple methods in our truck. The ET tube is then secured inside the patient's mouth. A balloon is filled to allow it to not dislodge. And then we use our Thomas lock to secure the tube inside the patient's mouth. Now with our tube secured, we can use our bag valve mask hooked up to 100% oxygen and ventilate the patient, provide oxygen as necessary. Thank you for watching, and happy EMS week to all those who serve our community.